Hello, and thank you for joining the tiered orientation training for preceptors. This training is for our new tiered skills acquisition model. By the completion of this training, the preceptor will be able to state the expectations for the role of the preceptor and the orientee within the framework, identify the core components included in each level of the tiered orientation framework, discuss scenarios for applying the new framework in practice, provide meaningful feedback, review the process and purpose of the orientee and preceptor evaluation, and locate preceptor resources. First, let's take a look at the responsibilities of the preceptor. Essentially, you will be following the orientation plan of the preceptee. You'll gradually advance their assignments with the goal of safe and competent care. You'll facilitate their job readiness by reviewing any assignments and validating the ability to provide that safe and competent care within their scope of practice. You'll be responsible to validate their skills and competencies through direct observation and other methods, and seek out clinical experiences to meet the needs of the orientee. You should also provide ongoing feedback to the preceptee, the clinical manager, and the clinical specialist regarding their performance. You'll also complete all required documentation by the end of the orientation period and continue to be a clinical resource for the preceptee even after orientation ends. So what is the Tiered Skills Acquisition Model, or TSAM for short? It's a structured orientation model in which the orientee and the preceptor will work closely together to care for the entire patient assignment. The orientee will gradually increase skills performed from simple to complex based on their current level or tier. As we go through this training, you will hear me use those terms, level or tier, interchangeably. As an organization, we have recognized a need for a standardized, measurable, and structured orientation framework. This tool is evidence-based and will help us align with organizational goals. We can measure the outcomes of this tiered skills acquisition model through surveys of post-orientation from the preceptor and the orientee, as well as looking at retention rates and length of orientation. The TSAM model will also help the nurse managers and clinical specialists have a clear understanding of the orientee's progress from day one and throughout the orientation until completion. The framework provides the tools necessary to evaluate progress using completion milestones with each level or tier to identify barriers early in the orientation. These tools will help us individualize plans for each orientee's orientation. We'll also have a clear competency validation process to assess readiness to exit orientation, and this will also assist leaders from a budgetary standpoint in scheduling. This framework uses Patricia Benner's novice to expert theory as well as Donna Wright's domains of skill acquisition. There are 6 levels or tiers for the tiered skills acquisition model. Starting with Tier 1, which is shadowing and observing for the orientee, which is only the first few hours of the first shift. But as you can see, as you progress through the tiers, the orientee and the preceptor have clearly designated roles in each tier. The orientee will only be responsible for a portion of the total nursing skills needed for their patients based on the tier that they're currently in. This model promotes building skills at a tiered approach based on completion milestones determined by the specialty area and the nurse's level of experience. The great thing about this model is that whether it's the new graduate RN, it's an experienced RN, or a nurse that is transitioning to a new clinical practice area, they can jump in at each tier and progress at a pace that is comfortable for them. So as you can see, Tier 2, this is assessment and documentation. So if it's a new graduate RN, this tier may take them slightly longer than it would that experienced RN who is used to working in that practice area. And the preceptor, during this time, they will be taking care of the entire patient load. They'll be doing everything for those patients, but the orientee is going to be responsible for all of the assessment and documentation for that care. Now, the preceptor, they should also assess and watch that charting and validate that the orientee is documenting as they should for their practice area. They're also, during this time, going to be showing them any resources or policies that are appropriate for their practice area, and try to narrate that patient care as they go along. The important thing to note about the tiered skills acquisition model is as the orientee progresses, they will continue to do the care for that tier as they progress to the next tier. So for example, as they complete Tier 2 assessment and documentation and move on to Tier 3, which is medication management, they should also continue to do the assessments and documentation. As they move forward to Tier 4, they will do everything from Tiers 2 and 3, as well as learning Tier 4, and so on. So let's take a moment to look at the tiered orientation plan instructions. So competency validation for each tier, it will contain objectives that are essential for the orientee to perform at an independent level. Prior to advancing the orientee to the next tier, they must demonstrate competency for each objective listed in the current tier. As they progress, as I mentioned before, they will continue to perform those skills and objectives from previous tiers. Feedback should be ongoing, and this is also true for the orientee as well. They should be providing you feedback as well as how the orientation process is going. But you are encouraged to provide feedback to the orientee regarding their skill performance every shift. You'll complete a weekly evaluation, which will be online, and I'll show that to you in just a few moments. But the orientee will also be supported through biweekly meetings with your clinical specialist. So they'll be an additional resource for the orientee. And they'll cover unit-specific skills and competencies. Upon completion of orientation, the preceptor and the orientee will also complete a survey of the orientation program and of the relationship between the preceptor and the orientee. In addition to the validation tool, there is a skill tracker, and this will focus on skills and experiences that are tailored for each nursing care area. These support the orientation and that they can be completed at any time regardless of the tier. And it's more of a vehicle for acquisition of skills and attitudes, behaviors, desired knowledge that's needed for competence. Whenever you're verifying those skills or experiences, you need to consider what is needed for either the newly hired or transferred nurse to safely care for each patient. While the skill tracker does not need to be completed by the end of the orientation period, the goal is to complete it within 6 months of the hire or transfer date. So looking at expectations, the preceptor is responsible to initial and date next to each objective or skill when that is verified. Also to complete that weekly evaluation and continually communicate feedback with the orientee. Clinical specialists will be meeting with the orientees on a biweekly basis, and they'll reference any remaining objectives, skills, or experiences that are in that current tier. The orientee is responsible to seek out resources to help verify any incomplete objectives or skills, and also to complete that weekly evaluation. So how do we verify? How do we verify competency? So competency can be defined as an ability to integrate complex knowledge that includes judgment, skills, and values. So there are various methods to evaluate competence, which include direct observation, discussion and reflection, simulation, skills validation, case studies, and computer testing. When you, as the preceptor, are verifying competency, you're indicating that the orientee has demonstrated, performed, or verbalized the objective with a high level of confidence. A high level of confidence means that you're confident they can perform this skill safely and independently for the patients. When you're referencing resources, show the orientee where they can go to find these resources. For policies, you'll direct them to Caroline and to the RSF Document Manager program. Within that, you can search keywords for policies. To obtain clinical skills, you'll also go to Caroline, go to Nurses Portal, and under Practice Resources and Clinical Skills, then you can search by keyword or by the title listed. Don't forget to show the orientee the other resources that are available under Nurses Portal, as there are a variety of practice, professional, and education resources available. The next page of the orientation document includes a place for signatures for each preceptor, as well as a place to sign to indicate that the weekly evaluation has been completed and at what orientation week and tier the preceptee is on. There is a QR code available here, so you can complete the weekly orientation evaluation on your phone, or you can click the link that is available. New graduates only will complete this survey at the completion of orientation. So let's move on to the first tier. So as you can see, each tier is only going to be on one page. So that means for that particular shift that you're working, this is the only page that you have to worry about. It clearly identifies the orientee responsibilities. You'll note the date that you're working in the tier, an initial and date next to each objective that's completed. Now, Tier 1 is for shadow and observation. So this is really for only the first few hours of the first shift, and then you'll move on to Tier 2. And in this, you're just helping them get acclimated to the unit. You're going to show them around. You're going to communicate, what the various roles and responsibilities are, and just help them get to know the other teammates that are working there as well. Notice on each tier, there's also a place for you to note activities and communication. So in this communication box, this is a great place for feedback. And we want to provide, clear feedback with the orientee. Obviously in this tier, they're just shadowing. So there's not really much feedback that you could provide other than, they seem eager, willing to learn, asked a lot of questions, that type of thing. You'll then sign down at the bottom. Moving on to Tier 2, this is assessment and documentation. So as I mentioned before, the orientee is responsible for all of the patient assignment. And for this tier only, it's just the assessments and documentation. Over to the right, you'll see all of the objectives that are listed out that are included within this. So what does that mean, right? They need to be able to perform an assessment that's appropriate for your patient population. This should include, a systematic head to toe. And also be able to, correlate the information that they review or, that they assess with labs and diagnostics. And again, there's a place here for activities and communication. Tier 3 is when we're going to add medication management, safety, and orders. So as noted before, the orientee is still responsible for everything related to Tier 2, and then they're going to add this information as well. So with medication management, this is including all of the safe medication management that is included with that. So asking for patient allergies, ensuring that they're giving the medication to the right patient at the right time for the right reason, and so on. So we'll conclude this video at the current time, and then you'll proceed to part 2.